Applied kinesiology all started in 1964 with Dr. George Goodhart. Dr. Goodhart was working on a patient's shoulder, and he tested the strength with conditionally inhibited, or in simple terms, turned off serratus anterior muscle. He then started to feel around in the muscle. He felt tender points at the origin of the muscle on the ribs. He proceeded to rub the tender points until the pain lessened. He then retested the muscle and it was facilitated. It was turned on. This was the beginning of applied kinesiology. Since then, we have learned much about how the muscles of the body can be restored to optimum function. We have also learned how the muscles of the body are holistically related in many other aspects of the body. But let's look into the AK treatment of muscles. In AK, we do things differently. We don't necessarily look to the tight or painful muscle to focus our treatment on. This is what most others in the physical medicine field do. In AK, we look for an inhibited or weak muscle. If there is a weak muscle, the other muscles in the area will tighten up and form trigger points because they have become shortened. So you could see that a shortened, tight, painful muscle is just a symptom. The tight muscle is usually not the primary problem. Here are some of the top localized problems that cause a muscle to be weak. The origin and/or insertion of the muscle, its attachment to the bone, has been pulled slightly off from the bone's periosteum. The spindle cells, which are the stress receptors of the muscle, need to be reset. The Golgi tendon organs, which are the tension receptors of a muscle, need to be reset. These are the top 3 localized muscle problems that happen from trauma to the muscle. If the muscle becomes weakened from any of these, it will form trigger points in other areas of the body. The antagonistic muscles on the opposite side of the body from the weak muscle will become tightened. This is known as a fascial flush type of trigger point that was researched by Dr. Janet Travell. The synergistic muscles on the same side of the body as the weak muscle will also become tightened. This is known as a strain counterstrain type of trigger point that was researched by Dr. Lawrence Jones. In applied kinesiology, we first address the weak muscle. Then we address the antagonist and synergist muscles that have been shortened. When this type of treatment is done, the results can be miraculous. Joint range of motion immediately improves. Pain quickly leaves. Inflammation reduces in a short time. When this treatment is combined with chiropractic assessment and correction of the nerve supply of the affected joint, if needed, the results can be long-lasting. In applied kinesiology, we are trained to look for the cause of the problem and then supply the quickest and longest-lasting solution to the problem.